Understanding Autism, Clinical versus Educational Needs in Texas. This video will address a topic that confuses many families: the difference between a clinical diagnosis of autism and the educational eligibility for autism in Texas. These two interpretations of the diagnosis don't always match, and that can leave parents feeling frustrated or dismissed. This video will help you understand the difference and give you tools to close the gap so your child gets the support they need. Clinically, autism is diagnosed using medical and psychological criteria, such as the DSM-5. A clinical diagnosis looks at social communication differences, repetitive behaviors, sensory differences, developmental history, and how these characteristics affect daily life. A clinical diagnosis looks at the whole child, including their home, community, and social settings. It is a medical and psychological determination. In schools, autism is defined under IDEA and Texas Commissioner's rules. But here's the key difference: educational eligibility is not about the diagnosis, it's about whether the characteristics of autism impact the child's educational performance and require special education services. This is one of the most frustrating parts for families. Texas schools are not required to accept a clinical diagnosis as automatic eligibility. Educational eligibility is usually based on the school's evaluation, not on private or external evaluations, including IEs. The evaluation has to show an impact on educational performance, not solely on home or community functioning. In addition, consider whether the child requires specialized instruction rather than just accommodations. Texas looks for communication differences, social interaction challenges, repetitive or unusual behaviors, sensory processing needs, and whether these characteristics affect learning, behavior, or access to the curriculum. A child may have a clinical diagnosis but still be denied eligibility if the school claims there is no educational impact. So a child may have a clinical diagnosis of autism, but the school may say they're doing fine academically. We don't see those behaviors at school. They only need accommodations, not special education. This creates a gap that parents must learn to bridge. Here are practical tools, parents, that can be used to connect the clinical diagnosis to educational needs. Bring data, not just the diagnosis. Schools respond to data. Bring examples that show how autism affects communication, social interaction, behavior, sensory regulation, executive functioning, emotional regulation, and independence. Use real-world examples. He shuts down when routines change. She cannot complete tasks without step-by-step support. He avoids group work due to sensory overload. Request an FIE that includes autism-specific measures. Ask the school to include autism rating scales, pragmatic language assessments, sensory processing evaluations, observations across multiple settings, and behavior data. If the school refuses, document the refusal. Connect clinical findings to educational impact. Translate clinical language into school language. For example, sensory overload when the child have difficulty accessing instruction in noisy environments. Social communication deficits can be seen from difficulty participating in group work or classroom discussions. Executive functioning challenges when the child needs support to start, organize, and complete tasks. This will help the ARD committee see the connection. Request a functional behavioral assessment, FBA. If behavior is a concern, even mildly, request an FBA. An FBA creates data that shows educational impact. Ask for speech, OT, or counseling evaluations. Autism often affects communication, sensory processing, and emotional regulation. These evaluations help show the need for specialized instruction. Document patterns over time. Keep a log of meltdowns, avoidance, homework struggles, social challenges, and sensory triggers. Patterns help prove educational impact. Use the adverse educational impact. Language. In meetings, use phrases like "this characteristic adversely impacts access to the curriculum." This affects progress in the general education setting. This condition requires specialized instruction, not just accommodations. This aligns your advocacy with IDEA language. A clinical diagnosis matters, but in Texas, it's only the first step. When parents understand how to connect clinical needs to educational impact, they become powerful advocates. Your child deserves support. Your voice matters. And you don't have to navigate this alone. For more information, contact the ARC of Harris County Wright Special Education Advocacy Services at 713-957-1600, extension 116.